Rakesh. Thank you very much. As was just mentioned, I'm Rees Midgley, and I'm here with my partner, Jim Wasco, who is an emergency room physician, as you heard. And we're here to discuss vCases. vCases is a diagnostic medical workup program, and we're going to particularly work up during this session a patient, and that patient is Gloria Williams. And so before doing that, I want to give you just a sense of what vCases is all about. Well, vCases is a computer-based case workup program. It simulates medical encounters in a very realistic way by providing unique, open-ended experiences in history-taking, physical examination, and test ordering, all with benchmarked experience. So we believe that vCases will help users become more skillful diagnosticians because experience-based learning is remembered. And vCases, we think, can be a game changer. We hope some people will agree with us. So why is vCases needed? Well, over 5% of all diagnoses in the United States are wrong. That is over 12 million diagnoses every year are wrong. And that is a minimum estimate. There are many estimates out there that say it's closer to 15 or even 20%, triple and even 4 times that number. But beyond that, diagnostic error is the major cause of malpractice cases and deaths. And those deaths are twice as many as are caused by auto accidents each year. So diagnostic error is huge. We want to find a way to help get at it. So why are there so many misdiagnoses? Well, for one thing, medicine is different now than it used to be. Medicine used to have time with a patient. There was time for history and a workup and a physical exam that was thorough. And now they're rushed or they're superficial with 10 minutes, 20 minutes, 5 minutes, whatever it is with a patient. That has to change. But we also, if we find some way to do this more quickly, more efficiently, we know that a senior physician is much more able to work up a patient than is a medical student, for example. And so we want to help get everybody to be much more professional and capable. So what we've done is where tests will substitute for analysis, that's what happens. Tests substitute for analysis. There's never enough case workup experience, particularly for medical students, but certainly true for residents, and it's also true for practicing physicians. And physicians now think they know what the diagnosis is, but too often they're not thinking critically. And we know that critical thinking is one of the major causes of misdiagnosis. So I want to now have Jim talk to you about Gloria Williams and work this patient up.
Thanks, Rees, very much. And it's a good presentation and a good opening to our thoughts behind vCases, because physicians don't have a lot of time. And sometimes if they don't think critically, if they miss the appropriate history, they miss the appropriate physical or the appropriate test, they come to the wrong diagnosis. So what vCases does is it has a series of patients, and the patients present to the user of vCases like a patient would present in a doctor's office with a chief complaint. But even before the chief complaint, we know the patient's going to be coming in, and so we have a profile, a snippet from the electronic hospital record, if you will. And this is a similar example of what we might get to any of the vCases patients. So here's Gloria. She's a patient that has, and we can learn about her past diagnoses, procedures that she might have had, any medications that she's on. We can also learn about family history and some of her health habits. Now you'll notice on the left-hand side there are some stars there. And that's because vCases will present all this information to you, and you as a user will decide whether you want to ignore some of that information, in which case you don't click anything, or you can star it. Or if you think it's vital to what you might be working with, you can star it with a little exclamation point. And vCases will record all of the issues that you have starred, all of the items that you've looked at, and it will computerize these and add them up at the end so that you can actually have a score of how you were going through the case and compare yourself with others in your same cohort. Anyway, Gloria comes into the office and here's her complaint. What can I help you with today, Gloria? Well, I've had constant pain in my back yesterday and it's been getting worse all day. Okay, so that's important. We're going to star it and go on from there. And here's a history now. I know we're allowed by using vCases to ask examples anywhere in this history area. So we would check hematologic history, nasal history, whatever, but just for purposes here, we'll check general. And once we check general, a number of prompts come up which allow us to investigate or explore any of these areas in depth. We might want to ask, for example, if Gloria is tender. And so we'll click on tenderness. And we'll ask her first, do you have any areas that are painful to touch? And she says, yeah, for 3 days my abdomen and back hurt. Well, let's hear more about that. It's not only important to know that she's tender, but what are the attributes of that tenderness? We think this is important, so we're going to click on that, obviously. And then we'll find out, some of the other areas that are important to her. So we find out by asking the questions from vCases more about the tenderness. Where is it? When did it start? What makes it worse? What makes it better? Now we have an option to go through any of these previous areas of the history that we've showed you and ask any one of a number of questions that have come up. Once we do that, we will come up with a differential diagnosis. And the differential diagnosis will be many patients as we can think of that will present with a history of that Gloria has presented to us. To cone that down further, we'll then proceed to a physical examination. Again, we're given multiple choices that we can evaluate. And let's just pick abdomen and genital, for example, and subset the patient, the area abdomen. And what kind of information will we come up with if we examine Gloria's abdomen? Well, we find out here that her abdomen is a little distended, her bowel sounds are decreased, and we star those things because we think they're important. We also note, and we star it with an exclamation point, that she looks uncomfortable in bed. So that means that there's something really pretty serious going on. Now, please note that everything that I select there will be recorded in the evidence panel over on the right. This is essentially an area of case notes, where you can make a notification of any of the items that you have found in your workup of Gloria Williams. And that means that while you're doing this program, which is on a computer, of course, if you want to stop it and go have dinner or pick it up later when you get home, all of your notes will be there so you can just pick it up right from where you left off. After you've done your physical exam, and it's obviously going to be much more complete than what we've shown you here, which is just a simple abdomen, we will come up with a narrowed differential diagnosis. Whereas before we had 8 or 9, now we're down to 3 or 4 or 5. And so now in order to separate those items, we would want to do what most physicians do, and that's order a series of tests. So that's next in the vCases navigation.
Sorry, Jim, they've substituted our talk. So
okay.
One we sent in a month or two ago is not the one that's being shown, so we're having troubles with it. Sorry.
All right. Well, anyway, yeah, we'll do a series of tests.
So anyway, maybe I'll take this right for the moment then.
Okay, sure.
I can back up here if I can get this to work. I got back up. Sorry, put one more up here. I go back to there and go forward one. Okay, so I want to take a look at vCases for a minute. And the electronic health record we looked at, a little bit of it, and we got some information. It was background information. This is information that gives us ideas about what the diseases might be, but it's a huge number from those risks, because risks are common to many, many diseases. We then go on and take the next level we took, as Jim went through, we look at the history, and it gives us initial differential diagnoses, and the history can eliminate a lot. So we're down now to a small number, as he showed you. But as the physical exam take us still further, here it's brought it down to 3, and then we take it down once more to some basic tests. We haven't shown those yet, and then after the basic tests, we get a confirmation, and then there's an epilogue you will see in a minute. So Jim, why don't you, I think it's yours next. No, it's not either. We build all this under something we call a simulation engine. And that simulation engine is where we put it all together with the digital capabilities and through the computer, working through the cloud. So the medical knowledge obviously consists of diagnoses, and in addition to that, it consists of past history, symptoms, signs, and tests. And they are linked, so that past history can point to diagnoses, but diagnoses can point to history. But the same thing is true for symptoms, signs, and tests. And it's this interaction that makes it all possible and allows us to really build on critical thinking and making the right diagnosis. So, Jim, why don't you now take over?
We ended our patient encounter after doing the history and the physical examination. So now, in order to cone down our diagnosis further, as Rees has mentioned, we'd want to go to a series of tests. Now, vCases has built into it a rather rich possibility of investigating by testing. And that would include imaging tests, laboratory tests, and some procedural tests. And if we look at the library for a minute, we can order panels of tests, which are tests that are commonly ordered together, and get the answer from that, or we can order specific individual chemistry tests. vCases gives us the possibility to do any of these. If we take a look at the liver functions, for example, on this patient, when we might have considered that we are looking at a biliary tract problem.
It actually changed, sorry, it's changed to the comprehensive metabolic panel. It's fine.
That's okay. We've got a comprehensive metabolic panel, which is fine, and it shows us that there are abnormalities of some of the liver function tests, and some other liver tests are not abnormal, but we want to check the ones that we think are important, and again, that will be starred and recorded for us. Now, not part of this would be something that might more specifically be able to cone down to pancreatitis, which is one of our considerations. So we have a series of tests which are not panels, but individual tests that we can order. And if we're really thinking about pancreatitis, we might want to click on lipase, which is one of the tests that help us evaluate that further. Or there are other procedures that we could go through and look for a CT scan, MRI scan, whatever it is, and vCases will give us the report of those procedures.
Now we're on test.
Okay.
More on, whoops.
Yeah, well, anyway.
The procedures
you
go
to the next one.
talk
That's
about,
fine.
Jim, if you want the procedures.
No, that's fine.
We have lots of procedures as well.
Yeah, okay.
Okay.
So one of the key elements of vCases, and one of the reasons we're really excited about it, is that the very robust library, which is included in the vCases program, so that any sign or any symptom or any test that you are considering when you go through this program has a library entry into it which explains that sign, symptom, or test very well. It gives you an example of how these symptoms or signs present, what kinds of cases they might be appropriate for, what some of the complications of the signs or symptoms are if they're not attended to. So a very rich, robust discussion of each of these findings. But beyond that, there's also a list of diseases that you have considered in your differential diagnosis and many others. So if you want to think that you're considering pancreatitis, for example, and you click on it, in the library you will come up with some basic information about pancreatitis, along with symptoms, risk factors, signs, strategic overview, and a number of other areas that will go on from there. But here's the interesting and responsive part of the library, that when you click on the symptoms, for example, you will be shown now two issues. The basic description of pancreatitis that everyone knows is considered in black. And you also see some writing in red. Those are the findings that you have uncovered when you've examined your patient. So this responsive library will allow you to compare the symptoms that are typical of pancreatitis with the symptoms that your patient has. Now let's say you didn't pick pancreatitis. Let's say you picked pneumonia or pancreatic cancer or something else. The same will hold true, and you'll be able to compare diagnoses that weren't really accurate with your findings and see where you stand in the right differential diagnosis process. So anyway, what we have here is that we've done a history, we've looked at the past medical record, we've done a physical examination, we've looked at tests, we've consulted the library, and we finally come up with a diagnosis. And this essentially just explains what I've just said. So now the last part of vCases is an epilogue. So these cases are created by experts in the field who present to us in vCases a history and a physical exam findings typical of a case which is interesting to them. And the simulation engine of vCases allows us to take that information, put it into the computer, and develop a case. Then we ask the case expert to present an epilogue. That epilogue will show the user what are the salient or important parts of the diagnosis they've just gone through, and shows essentially how an expert would have reviewed or gone through that case.
Right. So as we mentioned earlier, we have benchmarking. We're scoring every single decision. Every selection is scored. Every interpretation is scored. The efficiency of completion of the workup is scored. The diagnoses are chosen, again, which ones you picked after the history, the physical, and at the end. And this allows us to then determine competency, how you did in history taking, risk taking, physical exam, test, and the efficiency, and an overall score in the working up of this particular patient. And this will allow you to compare it with peers. And so what we've done then is have a case workup, which provides the possibilities for realistic realistic workup and the simulation engine, we have a responsive library, and we have benchmarking. And these all come together, and what this is vCases. So the flight simulator, we're calling it, and I understand it may exist also in other places. iHuman, I think, has this. I haven't seen iHuman yet, the name flight simulator, but we picked it up independently, whatever. Anyway, so who benefits from this? Well, certainly medical schools benefit, medical students from practicing, certainly residency programs, physicians' pride, patient health, malpractice claims, medical journals, public perception of medicine, and then the risk management areas of insurance company costs, healthcare provider costs, healthcare system waste, and regulatory boards, ultimately through CMEs and so forth that would come out of this. So as a result, I want to show you this one next to last slide here. This is vCases, and there's a fourth-year medical student who's reviewed this. In fact, we've had a number of them, over 16 or so now have gone through it. But what she said was the following: intuitive and realistic, challenged me to think critically about the questions I asked and the patient's responses. The library feature was a great, easily accessible source of information. I felt connected with the patient and engaged in their clinical problem without the pressure of an actual clinical encounter at the hospital. So, as this young man is about to learn, and players of vCases will discover, experience-based learning is. Thank you.
Okay, we have time for a couple of questions.
Thank you.
Enjoyed that, thank you. And I'm a pharmacy professor, and I can actually see how this would apply quite well for our students who really need to have a better understanding of the diagnostic process to sort out things like drug-induced disease versus something
Fascinating.
else.
I hadn't thought about something like that.
Yeah, because we don't really teach the diagnostic process to them so that they understand how they
And students actually in all clinical areas are limited with the time that they get and the experience that they get. And practicing physicians are also limited. You know, they can only get it from their evaluating their many patients and going to CME programs, which, by the way, are getting much more expensive and much more hard to go to. And as doctors are more and more involved with clinical hospitals and settings, their reimbursement for CME is not that high. So this allows us the opportunity to do when we want and where we want. Great, thank you.
We're excited about it.
Yeah.
Right. We will certainly. We're a startup. We're just getting this together. What the problem is getting the content developed. You can imagine what we're trying to do is to acquire all that's known about all of medicine, all of the specialties, and put it into this one program.
That's pretty simple. It'll take us a week or two.
But we're going to need a lot of help to get there. Now, in the process, we will do this. We certainly want to get some CMEs going. That should be fairly easy to get certification through a university or through the state board. And once we get that up on some of our cases, we will continue to build and work from there. And then we're certainly going to collect data on everybody constantly. So we will know that anonymously.
As an example here, you know, let's take this pancreatitis thing, for example. Now there's, you know, how many differential diagnoses in pancreatitis? You know, we can think of easily 12 or 15, and there might be many more. So if a user goes through this case and thinks, well, maybe it's not pancreatitis, maybe it's a lower lobe pneumonia, or maybe it's pancreatic cancer or something else, then we need to have library entries for all of those differential diagnoses. And by the way, that also includes all the signs, all the symptoms, and all the tests that each of these differential diagnoses would require. So it's logarithmic in terms of the amount of information that needs to be available. So that's why we're madly now looking for clinical collaborators to help us develop these cases. But we have, so far, the computerized program which allows the case creator to be able to do that pretty easily.
Yeah, so I work in drug development, and eligibility
Right.
criteria for protocol. So we teach them
Yeah.
really well, and then the patient for 3 months, and then getting the wrong patient into the wrong step.
Yeah. Well, and you know, when we started working on this, we looked at other simulations that are out there, and basically they give you 3 or 4 paragraphs on a patient and then ask you to go on from there. But that's not the way medicine works. Nobody comes into my office or my emergency room with a laundry list of everything that's there or something clipped onto their chart which says I have one of 6 things. So what they tell me is I have pain. So in order for me to develop an idea of what's wrong, I have to navigate through a history, navigate through a physical, navigate through tests, and that's exactly what vCases allows us to do. So it teaches correct diagnosis, it teaches the right procedures, it teaches the right protocol.
Thank you very much. I apologize for the screw up. We sent this thing earlier, and then I had a USB stick, and the woman told me she'd put it in. I'm sure it was loaded, but I saw the end of the previous one somehow, and then backed it all the way up. So my error, sorry.
Yeah. Anyway, thank you very much for